Come in.
Hello, Mr. TK. My name is Sherry Hill, and I'm your nurse practitioner for today. How are you?
I'm doing alright.
Okay, what brings you here to the clinic today?
For an annual checkup.
Alrighty. Well, first I'm going to close the curtains. I'm going to wash my hands. Okay, Mr. TK, I'm going to take a look at your armband. Alrighty, great. Are you okay? Are you comfortable? Are you
Yes,
in any
ma'am.
pain?
No.
Okay, first I'm going to start at your head. I'm just looking for symmetry of the head. I'm looking at your hair distribution. Do you have any history of headaches?
No.
Any history of seizure activity?
No, ma'am.
Okay, so I'm just inspecting in your head. Now I'm going to palpate your head. Is it painful when I palpate your head?
Mm-mm.
All right. This time I'm also looking at your hair distribution. I don't feel any lumps or bumps, which is great. Okay, Mr. TK, now I'm going to assess your sinuses. So first I'm going to do your frontal sinuses. And I'm going to do your ethmoid. Now your maxillary. Any pain when I do that?
No, ma'am.
Have you noticed any drainage, stuffy nose?
No.
Okay. So now, Mr. TK, I am going to take this cotton ball and I'm going to touch you, and you just tell me where I'm touching you at, okay?
Alright. Left cheek. Right cheek. Forehead.
All righty. Great. Good job. Okay, Mr. TK, I'm going to assess your TMJ. I want you to open your mouth, close it, open, close it. I don't feel any clicks or anything, any pain when I touch it and when you open and close your mouth.
No, ma'am.
Okay. All right, Mr. TK. So right now I'm just looking at the symmetry of your eyebrows. I'm looking at your eyes, looking at the skin on your face. All right. So first, I am going to assess your eyes. But first, I want you to, can you shut your eyes for me tight? Can you smile for me? Can you wrinkle your forehead? All right, great. Any pain when you do that?
No, ma'am.
All right. Now, like I said, I'm just inspecting your eyes, your face, and all that good stuff. Any trouble seeing?
No.
Do you see an eye doctor regularly?
Yes.
Okay. So I'm going to shine this light in your eye, okay? Okay, now I want you to follow me. Pupils are equal reactive to light and accommodation. Alright, Mr. TK, I'm going to point this light at the center of your nose, and I just, okay. Then I want you to follow me without moving your head. Okay. Mr. TK, I'm going to hold up this board, and I want you to cover one of your eyes and cover one of your eyes and read off the letters that you see. You cover one eye with your hand. Okay.
EPSO.
Okay, now I want you to cover up your other eye, and I want you to read it backwards.
OSPE.
Okay, great job. Now, Mr. TK, I'm going to stand behind you, and I want you to tell me when you can see my hands, okay?
Yes, ma'am.
And you just say yes when you see my hands.
Okay. Yes. Yes. Yes, yes.
Alrighty. I'm just going to do it up front and tell me when you can see my hands.
Yes.
Alright, great job. Okay, now Mr. TK, I'm just going to inspect inside of your eyes. I'm going to pull down, look at your conjunctiva. It's pink and moist. Have you noticed any drainage from your eyes?
No.
Okay, I'm looking at your lacum aphromatis. Looks great. All right, Mr. TK, that completes my eyes. Do you notice any trouble seeing? Okay, great job. Um, Now, Mr. TK, I'm gonna look in your ears. Just gonna inspect your ears. Now I'm gonna palpate. Any pain when I do that?
Mm-mm.
Have you noticed any trouble hearing?
No.
No. Okay. I'm just gonna assess inside. I see you have a buildup of cerumen. Mr. TK, I'm gonna stand behind you and I'm gonna whisper in your ear and you let me know. You repeat whatever I whisper to you. Repeat it back to me, okay?
Okay.
54.
54.
28.
28.
Good job. Okay. Now, Mr. TK, I am going to look at your nose. I'm just looking for symmetry of your nose. I'm going to look inside of your nose. Have you noticed any drainage coming from your nose?
No.
Any trouble breathing? Okay. Then I want you to occlude one of your nostrils, and I want you to breathe out and breathe in. Then I want you to occlude the other nostril. Breathe out, breathe in. Any difference when you occluded your nostrils?
No.
Okay. Now, Mr. TK, I want you to close your eyes, and I'm going to place something on your nose, and you tell me what you smell, okay?
Okay.
Okay. Tell me what you smell.
Alcohol.
All right, great job. Mr. TK, I also need to assess your mouth. So I want you to open up your mouth for me. I'm looking for any sores, open areas, lesions, looking at your teeth. Your teeth are intact, no obvious cavities. That's great. So I want you to stick your tongue out for me. Say I. Uvula is midline. Okay. Now, Mr. TK, I want you to stick your tongue out for me to your chin. Okay, now I want you to stick it to both sides of your cheeks. Inside, yes. All right, great job. Okay, Mr. TK. Next thing we're going to do is I am going to assess your neck. And I'm just looking at your neck. And looking for symmetry. I'm going to palpate your thyroid. Have you noticed like any brittleness in your hair, extra dryness,
No.
any weakness? Okay. Now, Mr. TK, I'm going to stand behind you and I'm going to displace your trachea and I want you to swallow and tell me if you feel something, if you feel any pain. Swallow for me. Do you feel any pain when I do that? Okay. Good job. Okay. Mr. TK, now I am going to assess your lymph nodes. First, I'm going to do your pre-auricular, then your post-auricular lymph nodes, your occipital lymph nodes, and then your tonsillar, subclavicular, infraclavicular. Any pain when I touch your nodes?
No.
Okay. Okay, Mr. TK. Now I am going to have you lay down in the bed. Can I help you? Let's remove some of these pillows. If you want to scoot back for me. Now, Mr. TK, I'm going to stretch your neck at a 45-degree angle, and I'm looking for your jugular veins. I'm going to assess both sides. Then I'm going to assess your carotid artery. Okay, and I'm going to listen to your carotid artery. Mr. TK, I'm gonna have you stand back up, sit back up on the side of the bed for me. Can you turn your neck from side to side for me? Any pain when you're turning your neck?
Nope.
Okay. So, Mr. TK, I'm just gonna inspect your upper extremities. I'm just looking at the skin. If your skin is intact, looking at the color. I'm gonna assess your capillary refill on your fingers. We squeeze down. Okay. This time I'm gonna go ahead and I'm gonna assess your radial pulse. And then I'm gonna assess your brachial pulse. Okay, I need you to hold your hands up like this. And I want you to push towards me. Push your hand. Okay. And I want you to pull. Okay. Bilateral hand grip is strong. Can you move your wrist for me like this? How about, can you move your fingers? Okay. And just move your arms for me. Alrighty. No musculoskeletal deformities. Now I'm just gonna take a look at your chest. I'm looking at your lungs. Respirations appear even and unlabored. I am going to palpate for expansion and tactile firmities. So I want you to say 99 for me.
99.
99.
99.
99. Okay. And we're going to do the same thing at the back. We'll say 99.
99. 99. 99.
Okay, now we're going to do it again.
99. 99. 99.
Alright. Okay. I'm going to take a listen to your lung sounds. Do you ever have any shortness of breath with exercise, or do you exercise regularly?
Yeah.
Okay. It's very important to make sure you're exercising. How about, do you smoke any cigarettes?
No.
No. Okay. What about using any type of other drugs?
No.
Do you drink alcohol?
No.
Okay, that's great, Mr. TK. Listen to your lung sounds. Take a deep breath for me. 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 Okay, your lung cells are clear to auscultation. Normally I will perform this on bare skin. Now can you raise your arm for me? And I'm just gonna listen. Take a deep breath for me. Take a deep breath for me. Deep breath. Deep breath. Okay, now I'm gonna listen to your posterior lung sounds. Take a deep breath for me. Take a deep breath for me. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay. Now I'm going to palpate. But first I'm going to assess for any barrel chest. I don't see any barrel chest. Do you have any family history of lung cancer? No. Have you
No.
vomited blood?
No.
No. Okay. How about, have you had any cough?
No.
History or TB?
No.
Okay. Do you go and get your annual flu vaccines?
Yes, ma'am.
Okay. So now I'm gonna assess for crepitus. So I'm just gonna palpate. Alright. Great. Now I'm going to assess your heart sounds. But first, I am going to listen in your second right intercostal space for your aortic. And I'm going to listen on your left second intercostal space for your palmatic. Now your Erb's point in the third intercostal space. Tricuspid. And I'm going to listen to your mitral valve. I can hear S1 and S2, no murmurs heard. Okay, so now I'm going to assess your axillary lymph nodes. Alrighty. I don't see any pulsations or heaviness. So your apical pulse is what I assess for. That's also known as the mitral valve as well. Okay, now I'm going to take a look at your breast. I'm just looking at any pain in your breast area. Mr. TK?
Nope.
I'm just going to palpate. Tell me if you feel any pain. You feel any pain when I'm palpating?
No.
Okay. Normally I would do this on bare skin. So I'm going to palpate your axillary lymph nodes as well again. Your subclavicular. And your infraclavicular. Alright. Just looking at your nipples. I will look at your nipples, making sure they're symmetric. Have you noticed any drainage from your nipples? Okay.
No.
Alright. And Mr. TK, I'm going to take a look at your abdomen, so I would need for you to lay back again.
Alright. That's fine.
So first I'm just inspecting your abdomen. I'm looking for any bulges, pulsations. I don't see any bulging or pulsation. How's your appetite?
It's fine.
Have you vomited in the last few days? Or okay, well, how about feeling nauseous? Alright. Now, Mr. TK, I am going to listen to your bowel sounds. Normally I would do this without clothes on, over bare skin. Okay, bowel sounds are active. Now I am going to percuss. I should percuss over your spleen. Over your spleen, I should hear it should be tympanic sounds. And I'm gonna percuss over your liver. It should be dual. Okay, I'm going to percuss over your liver again. Then I'm going to palpate. Let me know if you feel any pain. You feel any pain when I'm palpating?
No, ma'am.
Alrighty. Any history of hernias?
No, ma'am.
Alright, how about any diarrhea?
Nope.
Okay. I'm going to look at your mid-axillary line.